we we listed. I think at this point in time, we all understand what the pelvic cavity. Maybe I remember I didn't prepare a PowerPoint lecture on that. All right, but for your sake, I will also try to prepare a separate lecture or PowerPoint on that and send to you. But at least we're able to we clearly understand what the pelvic cavity is, and we know that the um, the um, there's no clear distinction between the abdominal cavity and the pelvic cavity. But at least we're able to define some boundaries. Like we talked about the pelvic inlet, all right? We listed the bones that are included, the sacrum, the ala of the sacrum. At the level of the sacroiliac joint, even the iliac crest is even a part of it, all right? And we also have um, the arcuate line, all right? And we also have the pectin pubis, all right? The pectineal line, all right? Down to the level of the pubic tubercle, okay? And on both sides, you have this each of the pubic tubercle fused together to form what the symphysiopubic joint, all right? So the symphysis will also be part of it, all right? And the promontory, okay? The promontory, and then we can't go back to it. And we actually listed the for those who were not here in the physical class when we started the lecture, at least something for you to take on. And for those who were not able to get those lecture, all right, we can it's an opportunity for you to remember this part of it, all right. We also listed the structures in the pelvic cavity. If you take it from the posterior, you have the rectum, okay, and then you have the bladder. But in the case of the female, there is the uterus, okay, that comes between the rectum and the bladder. So the uterus in an activated position will rest on the uh, fundus of the bladder. All right, okay. So um, we have actually had a lecture on the rectum, and now we are looking at the second content of what the pelvic cavity, which is the urinary bladder. And we would also look at the ureter. All right. In the ureter, you actually treat it in two parts: the abdominal part of the urinary of the ureter, and then the uh, pelvic part. So it's actually a content, okay, of the pelvic cavity, okay, and it enters into what the uh, bladder as part of the urinary system. All right, serve as a conduit for urine through the what from the kidney to what the bladder. This that means if we are asked to state the location of the um, urinary bladder, we would not even have any problem trying to know the location of the bladder. But there's a slightly difference. They behave alike, the uterus and the bladder. The bladder can, you know what a pint is. A pint should be able to measure up to what 500 mil, okay, 500, 450 to 500 mil. Let's say 500 mil. And um, so what it means is, as per the bladder can um, stretch, or become distended when uh, when it contains about 400 half a pint, all right. I mean half a pint of fluid, in which case is urine, okay. At that point, the subject or the individual will become uncomfortable, okay, feeling that urinary pressure to urinate, all right. So the bladder can um, uncomfortably take what 250 ml of what fluid or urine, all right. That is it. Now when this bladder is distended, it will expand into what leaving the abdomen, as in it will extend from the pelvic cavity into the abdominal cavity. All right. And thank God some of us were able to draw this structure. Okay. And for those who cannot see what was on my screen, you saw it on the board, and it's the same thing that is being presented. You are looking at it from two, all right, views. Okay. You're looking at it from two views. But let's look at this view first. We'll look at the part of the bladder. You can see this we listed the part of the bladder. All right. The empty bladder has the shape of what? A pyramid. Okay, three-sided pyramid. Okay, that's the shape of what? Three-sided pyramid. And we can then go further to see if we can identify the parts of the bladder in terms of okay, from this shape we can see that we have on this side you have what? The superior what? Surface. And the point is this part makes up what? The base of the bladder. Okay. And then from this part that make up the base, below this part that make up the base of the bladder, you have down the inferolateral surface, which are two inferolateral surface. Okay. And then this is one inferolateral surface which is seen here. And then you have here is another part, the anterior border. Okay, is also shown. And then there's a posterior border and then the lateral border. Here you can see one side when viewed from one side, you're seeing an inferolateral surface. The same thing here. All right. And then at this point, okay, we define this point to be what? The fundus, or the fundus. But this at the base of the bladder. On this you have the superior surface, right? You have the superior surface. And the last part is what? The neck of the bladder. From this neck of the bladder we open into what? The urethra. All right. The urethra. All right. And then beautifully well we can see how the peritoneum, okay, covers slip onto on the surface of um, the base, okay, or the superior surface of the bladder. Okay. And then on both sides you can see how the ureter enters, okay, at the upper part of the what? The base of the bladder. Okay. At some point in the base of the bladder. Okay. All right. Now we can also appreciate the fact that on this base, the base of the bladder has the shape of a triangle. Okay. All right, on which you also have a base and then an apex. This part called the apex is closely applied or related to what? The pubic symphysis or the pubic tubercle. Okay, in an empty bladder. And from it, eh, continues what? Or extend what? The uracus. Okay, this is the you call this the median umbilical ligament, which attach the bladder to the anterior, connect the bladder to the anterior abdominal wall through this median umbilical ligament. It is a remnant of what? The uracus. Okay, it is a remnant of the uracus. Let's see the next slide and see what we have to appreciate from it. Okay, and so we have the base, eh? We have the apex, we have the superior surface and two infralateral surface. Okay, two infralateral what? Surfaces. Here we can see how closely applied the apex of the base of the bladder. Say it's a triangular shape, and its base, okay, you have the apex being closely related to what? The um, the pubic bone. Okay, and then it is separated from what? This fascia. Okay, all right. And now you can see the median umbilical ligament, which is a remnant of the uracus, which attach the what? Bladder, or connect the bladder to the anterior abdominal wall. Here you can clearly appreciate how it runs posteriorly what? On the peritoneum, okay, to what? Down to the level of what? The umbilicus. Okay, that's it. Yeah, would actually look at the relation of what the bladder. All right, we'll look at some of the relation of the bladder. So I think we can actually appreciate something here. Now, I actually want to see if we are actually communicating. Please, at this point, oh, I only say some point in the along the in the lecture would have I'll take at. It's okay, no problem. I'll find a way to go about that. All right, I'll find a way to extract these names. But I hope you can all hear me. I hope I'm not talking to myself. Can you hear me? Hello, can you all hear me? Please, a response from you. Okay, fine. And also, are you? Can you really understand what we are talking? Okay. If you can understand what we are talking, then I think we are good to go on. Okay, we are good to what? Go on. It's a bit encouraging. At least we have 42 students in this class, so that means it's okay. It's okay. Now, here you say the relations, okay, of the bladder. Hmm? We also take these things in their parts. The first is what? The base of the bladder. Okay. Hmm. The first is what? The base of the bladder. Uh, Let me see which of these slides would be able to make use of. Here is showing that of the female. Here is showing both the male. Okay, on so different view. All right, and in this place we have still the male, and then we can actually make use of any of this image for this explanation. Okay, so let's see which one is the best for us. All right. I'm so stressed out and a bit tired. All right. So we have the base of the bladder. Okay, or the most. Hello. I hope you can hear me. Something just happened. My screen went off. Okay. So I'm back again. Let me share the slide. All right. Let me quickly share the slide. I hope you can all hear me. I'm back again. Can you hear me? Hello. I want to get a response from you. We are continuing the lecture. All right. So we continue. Okay. So can you see the screen? All right. Can you see the screen? Can you all see the screen? Yes. All right. I just believe that you can. Okay. So we go ahead with the lecture. So again, I'm talking about the relation. We are looking at the base of the bladder. Okay. We are looking at the base of the bladder. All right. And again, say the you can also describe it as because the base extends into the posterior surface. Okay. So most of the base or the posterior surface, like we said earlier on, will lie what below the level of this. If we remember our lecture on the rectum, okay. If we remember our lecture on the rectum, we actually talked about the peritoneum, okay. And we look at the different the pouch that were formed. We say that the peritoneum end almost at the level of what the second part of what as close to the ampulla, right? Almost at the level of the second part of the what the second flexure that's seen in the rectum, okay. Okay, from that level, okay, from that level, which is almost at the level of what, eh? So it's almost at the level of the um, as you can see on the screen, okay. You can see it at the level of the fourth, okay. It's fourth, I think third or fourth sacral bone, okay. Third of that's this is third, this is fourth, I think at this level, all right. And then pretty well you can appreciate the fact that okay, it's actually a bit it's a bit at the ampulla, all right. And you can actually feel this patch, especially when it contains much fluid, okay, much peritoneal fluid. Now let us see very well. The peritoneum is reflected onto what it takes a forward turn to run on the surface of the on the superior surface of the bladder, so that you see that most of the base or the posterior surface of the bladder, okay, it's the upper part is covered by what, most of it is covered by what, the is related to the peritoneum posteriorly, and below which for the male you have your what, you have the seminal vesicle, okay. And so the upper pole of the seminal vesicle is also related to the what, the peritoneum. It's related to the base of the bladder. All right. So I think that information has not changed. All right, it hasn't changed. We're still uh, working with that. Sorry, my system is hitting. Um, Let me see how we manage to go ahead with the lecture. All right. The noise. So the lie below what the level of what the rectovesical pouch. Okay, the pouch for the female it's different, right? For the female it's different. For the female you'll be looking at the same. In this case, in the female is the rectouterine pouch. Okay, look at in this place the rectouterine pouch and the upper part of the vagina and the fornix, the part of the uterus that the cervix that project onto the vaginal fornices. Okay, all this place is related to the posterior surface of the bladder or the base of the bladder. Okay, and of course, in the male, we agree or we know, as you can see on the structure, that there is nothing in between. But for the female, you have this. Okay, in the female, in this case, you'll be dealing with what the rectouterine pouch or pouch of Douglas. But of course, for the male, is what the rectovesical what pouch. That is, you can see it. Let's just quickly appreciate that. All right. Hmm? Then please tell me, is there any confusion at this point, or you can follow up? Let me know. Can you hear me and can you follow up? Are you following up with the lecture? Yes, no response from anybody. I actually want to know if you are with us, if you are with me in the class. Yes. You just I mean, are you following up? Are you in this class? Are you following up with the lecture, or is there something I should take back again, or you go back to what did we do? Okay, what one person says they can't see the labeling well. I will make the slide available for you. Okay, I'm actually looking at your chart, your response. At least let me be sure that I'm not talking to myself. So from time to time, I do come back. Now, if I go back to the slide, I don't know if we can see the labeling. But it's not about the labeling. Actually want us to appreciate the fact that if we see something, we can identify it. Forget the labeling will not be different from what is being shown to you. But okay, fine. Just follow my pointer. Follow my pointer. Look at this place that is peeled off. Okay, this place. Just look at this. This is the peritoneum. All right. This is the peritoneum. Now let us trace this peritoneum. Eh? Trace it with me. So and so and so. All right. That's it. That's it. And then look at how the peritoneum at the level of the ampulla of the rectum, okay, which is also at this vertebral level, you could see how the peritoneum sweep forward and upward and take a turn and sweep forward and upward onto what the base or the superior surface of the bladder. This is it. You can see the outline, okay? That is the peritoneum. And it leaves a recess or a space that is referred to as a pouch. Pouch, we can also use the term pocket, all right, because it becomes like a pocket of fluid, all right. And if that is the case, okay, this pocket of fluid exists between what the rectum, all right, posteriorly, and the bladder anteriorly, and so it's named according to that pocket of what space or recess or pouch as we refer to. And anatomically we describe the two structures that are involved, which is what the right rectovesical pouch. In the case of the female, as you can see here in this slide, let me look at it. Okay, in the case of the female, it's different. In the case of the female, you will be looking at two pouch, okay, that is for two pocket of the space, two pocket of space that are formed by the peritoneum. The first is you have the bladder, the rectum, and then you have the uterus, okay, and then this as it behaves the same way it behaves with that of the male, because the bladder is what the uterus is what is now in the place of the comes before the bladder. You have the recto uterine pouch, in this case usually referred to as pouch of Douglas, okay, but of course the anatomy would have described that pouch. Look at it now, you can trace the outline, all right. And then the in the case of the uterus and um, um, the bladder, you will now be looking at what uh, uh, uterovesical what pouch. Okay, but most of the time this is even very much more significant clinically or anatomically. All right, so if you can see, okay, fine, it's a beautiful image. You may not be, you have to look clearly for you to see the labeling, okay? But I promise I will make the slide available for you. But for you who say you cannot see the labeling well, I want to believe that really there's a point that you were not following. So if it's only you that could express yourself, I want to know now, have I answered your question? I mean, can you see the can you get the explanation? I think the person's name is Itoyo Pius 276. I hope I, Itoyo Pius, I think that's his channel name of his channel. I hope you were able to get the explanation, even if you are bothered that you cannot see the labeling clearly. I will make the note of the slide available for you. Okay, you would see it. Hmm? Maybe you can look at it. They have actually selected those things, those pictures were the best pictures you can actually study it. Okay, there are other better pictures, anyways. Let me not say, but for me, it's best because it gives you a better dimension so that you can really, really appreciate it. It's closer. Honestly, it's almost close to what you will see in the dissection, okay, in the cadaver. I hope in the shortest time we'll be able to explore the bladder. Thank God most of us are already in the abdominal cavity or the peritoneal cavity. All right, all right. Now, I I hope you can also see the fact that uh, you can see. Let me see this other slide. Okay, this other slide. Now let us look at it. Okay, still on the base of the bladder. Okay, this, let us quickly appreciate how the ureter is able to enter at the upper corner of the base of what the bladder. This is the ureter, right? This is one, this is two, and then you can also see the vas difference, okay, or ductus efferentis, or vas difference, whatever I call it, okay. You see how it's able to turn right, turn around the what went around this ureter, okay, and then would continue its course, as you can see in this image here. All right, you can see it turned. All right, it went round, okay, the ureter. That means it will enter the medial side of the ureter and continue towards the what in front, okay, uh, pass on the superior surface of the bladder, right, or the base, okay, to find a way to enter into what the the sorry, it's coming from this, okay, so it will pass in front, okay, wind round, okay, on the medial side of the um, the ureter, okay, on the base of the bladder. And you see how it's, you can actually appreciate this doctor's different, I mean the seminal vesicle, I mean you can see how the his doctor's difference, together with the seminal vesicle enter right the ureter through the posterior aspect, okay, of the prostate. We'll actually look at the prostate gland, okay. I think that should be our next lecture. All right, it should be our next lecture, the prostate, okay. So that is it. You can actually see it, you can appreciate it. Here you can see the prostate, okay, again. below the prostate line, below the neck of the bladder. All right. All right. Let me see if some people are following. I would actually want to see if there is any complaint right now. Please, is there any complaint? See, for now, can you forget about attendance? And I would want to hear if you actually have a complaint, like you cannot follow up or you're not seeing the things that is being pointed out to you, highlighted. Let me see your response. Are we following? Are we following? Okay. Let me quickly rush. Okay. I don't know what to do. Um, I think we've done so much about it. We've talked about the female. Okay. We've talked about the female, the relation of the base of the bladder, okay, compared to that of the female, and then we see that there's actually a firm connective tissue, okay, that will unite with what the anterior what vaginal wall, okay, on the what anterior what vaginal wall, and as well as the upper part, okay, of the uterine cervix, okay, into what the intervening peritoneum, which we talked about, okay, and then the as for the infralateral surface, okay, we expect that, okay, just like as you can see here, you see it sloping downward. eh? Can you see it sloping downward? All right, how it slopes downward, okay. On both sides they will meet. On both sides they will meet at the neck of the bladder. Let me see a clear image here. Let me look for. Okay, fine. Let me take this one for instance, okay. This okay. Here you can see the infralateral surface sloping downward to meet on this side at what? At the neck of the bladder. All right. All right. This is one infralateral surface. This is another infralateral surface. Okay, sloping downward. Okay, meeting at the neck of the bladder. Okay, we can see that. You can quickly imagine. All right, what will be the relation of what the posterolateral surface of the bladder. Let me see, my battery is down. Let me plug it quickly while we continue the class. I won't waste much of your time, sorry. All right, so again, they slope downward, okay, and medially to meet their fellow, like meet at what the apex of the bladder, so they lie with against what the front of the what the pelvic diaphragm, okay. That's the front part of the pelvic diaphragm. On this side, you will see the obturator internus also, okay. You will see the obturator internus, okay. I think we've talked about there's what is called the retroperitoneal space, okay. The retroperitoneal space lying what behind the pubic bone and the pubic symphysis, and there is also the retropubic space of ureter, okay, and that will contain what fatty tissues and then fibromuscular ligament, okay, and thus this it extends, okay, from the neck of the bladder, okay, to the what inferior surface or inferior aspect, okay, of the pubic bone. We should be able to see those things in this image. All right. uh Let me see it. We won't see that here. Okay, this is it. Rectopubic space, okay. All right, the rectopubic space. I hope, let me see those who can see. Okay, if you see the rectopubic space, please can you indicate? I want to get a yes response from you. Okay, Rejoice, the network is somehow bad. How bad it is? Lydia Rose saying that the network is getting bad. The point is, can you hear me? Okay, okay. Lydia, you say you cannot follow. Can you quickly just in a short, as in quickly type where did you not, as in where did you miss out? You're still talking about the labeling that is not clear. The labeling, let me see. I said something. I don't know which part of the labeling you want to get clear. I will give you the slide. I said so. I will give you the slide. I'll make it available for you. Okay. The labeling, you may be looking at the labeling. Sometimes I don't like using something that has too much of what a label. Okay. I don't like using something that has too much of a label. At least you should be able to describe the feature which we want to explain or talk about. You should be able to show the feature we are describing. Now, I don't know the labeling you are seeing. Okay, fine. When the slide is available, you will get it and follow the labeling. But now let us look. You can agree with me this is the bladder. You can agree with me this is the pubic bone, okay? And between this bladder and the pubic bone, there's a space called what? The rectopubic space. I don't, it's not labeled here, but let us just appreciate it. Look at it. Look at it. Follow my pointer. Let me change the color of my pointer again. All right. So I think we'll try to make use of a different color outline. No, this is something different. Sorry. Let me try to change the color of my pointer. Okay, fine. We can go. This, if you can see this, this is a space. This space exists between the bladder, why is it not drawing? The bladder here behind and the the pubic bone, okay, or the symphysis pubis, okay, it exists between there, okay. You can see it clearly. And the space, let's trace the space. This is what? The recto, let me write it, recto, sorry, not recto, rather retropubic. That's the retropubic space, okay. Can you follow? Hello, can you see the illustration there? Hello, let me get, the network is getting bad. Okay, did somebody see the labeling that I labeled right now? The retropubic space. All right, fine. Again, like I said, let me go back to the slide, okay. The as the bladder, okay, as the inferior, sorry, the as you look at the anterior, if you look at the inferiolateral surface, you say the slope downward to meet what, on the either side of what they meet themselves, okay, on both sides, and it will lie in front of, right, it will lie against the diaphragm of the pelvic, that's the pelvic diaphragm, and the obturator internus, okay. And okay, we will talk about the fact that, okay, that they will meet at the apex of the bladder, okay, at the neck of the bladder, all right. And also a space there, which is what we say retroperitoneal. That means it covers only a part of the bladder. It's not, of course, the bladder is retroperitoneal, okay. Now, behind the pubic bone, okay, and the symphysis pubis, all right, and the bladder, there's a space between them which I also actually spelled out, okay, and that space is called the rectopubic what, retro space, not recto, sorry, get me right, retropubic space, okay. You can call the name of the person who actually described that earlier on, which is Enradius, okay. All right. And then in that space, what we can appreciate is the fact that there is in this space, okay, it exists between the within this it exists between the bladder and the pubic bone. Now, within this space, you find what ligament, a ligament. It's a fibromuscular ligament, and the ligament is between the infralateral surface of the bladder and the look at the pubic bone. Okay, look at the bladder. Okay, then this ligament exists between them, so we can call it what the uh, uh, tubovesica. Vesica refers to what bladder, so the bone, the pubic bone that's involved. So the tubovesica ligament, okay? It's actually a fibromuscular ligament, all right? It's actually a fibromuscular ligament. And to the what? The bladder neck, and also to what? It explains that to the inferior aspect of the bone, of the bone. So the lowest part of the bladder, which we all agree is what the infralateral surface is the neck, eh? Where the base, both the base, the infralateral surface, as just three things they will meet. All right, all right. The base, the infralateral surface, and that's both the base of the bladder. Here you can see the base of the bladder. All right, right. That's the posterior surface coming down. The infralateral surface, eh? On both sides. No, there are two infralateral surfaces, and then you see the base of the bladder. At the point where they meet, all right, is called what? The um, it's called the um, neck of the bladder. All right, it's the lowest part of the bladder. All right, and it is pierced by what? The urethra. All right, the bladder neck is pierced by the urethra. Now, if we okay, fine. Look at the space here. Look at this space. It's actually shown in this image. A clear what? A clear labeling. Okay. Then the let's look at the bladder neck. Inside of the bladder neck, on it you would see you see when the ureter open into the corner, uppermost corner of the base of the bladder, it continues into what? Into the bladder, and at a point close to the bladder neck, okay, a triangle is formed, okay. The muscle of the bladder generally is what? The uh, the protrusion muscle, okay. And then here you have what? The trigone muscle, which is formed by what? The ureteric fluid, as the bladder enters into the as the ureter enters into the bladder, it continues on both sides so that the left and right ureter will meet eh, at the uppermost part that forms to form the ureteric fluid. This fluid form the what? The the this fold forms the uppermost part of the trigone muscle, okay, the trigone, okay, and then it forms a triangular shape that at the apex of this trigone is what? Is where the ureter will continue just as it's seen into it. So that with this trigone area, you have the ureter open into the uppermost part, upper angle of it, and form the ureteric fluid. This forms the boundary, upper boundary, and then at the apex is what? The urethra. That means this trigone leads into open through as it continues inferiorly as what? The urethra, okay? The urethra. Alright. So at this point, we'll say this what? The formation of the internal urethral meatus or orifice. Internal urethral orifice, okay? Orifices. And something very important, the mucosa of the bladder, right, is loosely attached to the loosely attached to the bladder, okay, but in the area of the trigone it is firmly attached, and the trigone area is what? is smooth. Okay, I think we have spent so much time here. Maybe do you think we should um, do you think we should continue this, or we should, this is about an hour, or should we okay, let me see. I hope you are following up. I'm not talking to myself. I see a lot of people are actually not here with us. Okay, I'm actually not getting any response from you guys. Just come and drop a matric number. Perhaps drop a matric number and go. Where is the, are we following up? No, sorry. The time come back again and continue, reconnect. But there's no problem. Would want to come back to this video later for reference. Okay, I will actually cut those parts that the system went off. Okay, and what you have is it will be a continuous flow, so you can actually come back to look at it. But that can only be available 8 hours and re-upload. So you can come back and watch the video. Okay. By then I would have also shared the slide. I'm actually done. Maybe after this class I'll quickly share the slide to you. There are links, okay? There are links you can actually look at, okay? Now, the ureteric bowel or ureteric food or ridge, okay, when the bladder is not distended or in an empty bladder, the that's this these three openings that are that forms the boundaries, okay, of the trigone, okay, they are just about 2.5, 2.5 centimeter apart from each other, okay. That means from the left ureteric orifice to the uh, urethra is about 2.5 centimeter apart. Same thing for the right, the urethra orifice. Okay. Now, when the bladder trigone area becomes what, the distance between the trigone area between the orifices, all right, ureteric orifices and the urethra orifice, all right, will be 5 centimeter apart. 5 centimeters apart, and um, you can actually uh, see that. Okay, you can see that when you actually do cystoscopy and then try to take a measurement of these orifices. Okay, now I think I skipped something. Let's look at the superior surface of the bladder. Okay, let me take a little bit back on the superior surface of the bladder. The male bladder. So okay, so okay, if you look at this place, okay, I think I actually explained it earlier on. Okay, I actually explained it earlier on. Said what is covered by the peritoneum. Okay, and then the the bladder, when the bladder is extended, it will what, move. It doesn't. It try to sweep the peritoneum from behind what the rectus abdomen. That will leave the what, the transversalis what, fascia. Leave the what, transversalis fascia. Okay, on the back of the muscle. If you, I think we're not able. We talked about the transversalis fascia, the other fascia, but we couldn't see all of them. This, we know what the transversalis fascia should look like. Okay, so the distended bladder, all right. we strip or we try to strip from behind the rectus abdominis, okay, to leave the transversalis fascia at the back of the muscle. So again, I said something that if the bladder is extended, you can use it to um, when the bladder is extended through this because it sweeps behind the transverse fascia to leave the rectus abdominis. Of course, the transverse. You remember after the transversalis fascia, you go deep. Okay, the next thing is what the peritoneum. Okay, the parietal layer of the peritoneum. So you can actually put a cannula scalpel at the midline. Okay, of the transversalis of the above the pubic, okay, that's midline suprapubic incision or cannula can pass through what the to enter into the what bladder, and doing that you will not have to enter the peritoneal cavity. That's what you can see. And then the next slide is we've talked about the trigone model. So let me see how we look at the ureter. All right, the ureter. Okay, fine. Let's look at the blood supply. Okay, the ureter. But first, the bladder is what? Uh, is what both the superior vesica and the inferior vesica what? Artery. Okay, the inferior vesica artery, as you can see, is what? Eh? Is a branch of the internal iliac artery as well. Okay? And then the superior vesica artery is also a branch of the internal iliac artery. It will both supply the what, the bladder, and it has the inferior will give branches to or distribution to both the body. Now the venous drainage of the bladder will not follow. Take note, it doesn't follow the corresponding artery. Okay, so instead it will form a plexus. It's a bit complex. It will form a plexus. Okay, around the fascia that is between the around the prostatic fascia, okay, or around a plexus here, around this area, okay. So this, once it's formed, it's been collected, okay. I mean, they'll form a plexus of vein. Hello, I want to see your question concern. I think so many of us are really not following up. The lecture has been too long anyways. So we would actually end now to, okay, no question. Okay, in the absence of any question, can I assume that you have actually understood or you followed up to now? Did you follow up till now? All right, thank you for being here with us. You have actually had a very busy day, and I don't want us to push you. So you may have. Is it possible that we can meet physically on Saturday, please? Hello, can we meet physically on Saturday? What about Sunday? Sunday, can we meet? Hello. All right, let me quickly call this class off. Okay, I'm open to your question. We will meet. Thank you once more.